Clinical Scenario 1. A 10-month-old baby boy is brought to the emergency department by his parents with a history of fever, vomiting, and diarrhea for 3 days. He is lethargic and has poor skin turgor. On examination, his temperature is 39.5 degrees Celsius, his heart rate is 140 beats per minute, and his respiratory rate is 40 breaths per minute. He has sunken eyes and a dry mouth. He is dehydrated and has signs of shock. What is the most likely diagnosis? A. Sepsis, B. Gastroenteritis, C. Pneumonia, D. Meningitis. Answer: A. Sepsis. Explanation: sepsis is a life-threatening condition that occurs when the body's response to infection damages its own tissues and organs. It is most common in children under 5 years old, and it can be caused by any type of infection, including bacterial, viral, or fungal infections. The treatment for sepsis is hospitalization and intravenous antibiotics. In some cases, children with sepsis may also need fluids, blood transfusions, or oxygen therapy. A 7-year-old girl is brought to the clinic by her mother with a history of abdominal pain and vomiting for 2 days. She also has a history of constipation and difficulty passing stool. On examination, her abdomen is tender and distended. She has a palpable mass in her right lower quadrant. What is the most likely diagnosis? A. Appendicitis, B. Intussusception, C. Constipation, D. Gastroenteritis. Answer: B. Intussusception. Intussusception is a condition in which one part of the intestine slides into another part of the intestine. It is the most common cause of abdominal obstruction in children under 2 years old, but it can also occur in older children. If intussusception is not treated promptly, it can lead to bowel necrosis and death. The treatment for intussusception is usually air enema or hydrostatic reduction. In some cases, surgery may be required. Clinical Scenario 3. A 3-month-old baby girl is brought to the clinic by his parents with a history of fever and rash for 1 day. The rash is maculopapular and is located on his trunk and extremities. She is also irritable and has poor feeding. What is the most likely diagnosis? A. Measles, B. Rubella, C. Roseola, D. Chickenpox. Answer: C. Roseola. Roseola, also known as sixth disease, is a common viral illness that affects infants and young children. It is caused by the human herpesvirus 6, HHV6, virus. Rash, usually maculopapular and located on the trunk and extremities. The fever usually lasts for 3–4 days, and the rash usually appears after the fever has subsided. Roseola is a self-limited illness, and most children recover without complications. There is no specific treatment for roseola. Treatment is supportive and includes fever reduction and hydration. A 12-year-old boy is brought to the clinic by his mother with a history of headache, vomiting, and stiff neck for 1 day. He also has a fever and photophobia. What is the most likely diagnosis? A. Meningitis, B. Encephalitis, C. Migraine, D. Sinus infection. Answer: A. Meningitis. Meningitis is a serious condition that requires prompt treatment with antibiotics. The treatment for meningitis depends on the type of infection. Bacterial meningitis is treated with antibiotics. Viral meningitis usually does not require antibiotics and resolves on its own. Fungal meningitis is treated with antifungal medications. Clinical Scenario 5. A 15-year-old girl is brought to the clinic by her mother with a history of weight loss, fatigue, and amenorrhea for 3 months. She also has a history of polyuria and polydipsia. What is the most likely diagnosis? A. Type 1 diabetes mellitus, B. Type 2 diabetes mellitus, C. Anorexia nervosa, D. Celiac disease. Answer: sad face. A. Type 1 diabetes mellitus. Type 1 diabetes mellitus is an autoimmune disease that causes the body to attack and destroy the beta cells in the pancreas. The treatment for type 1 diabetes mellitus is insulin therapy. A 2-year-old boy is brought to the emergency department by his parents with a history of fever, cough, and shortness of breath for 2 days. He also has a history of wheezing. On examination, his temperature is 39 degrees Celsius, his heart rate is 140 beats per minute, and his respiratory rate is 50 breaths per minute. He has tachypnea and intercostal retractions. His lungs are crackles on auscultation. What is the most likely diagnosis? A. Asthma. B. Pneumonia. C. Bronchiolitis. D. Croup answer. C. Bronchiolitis. Bronchiolitis is a viral infection of the small airways in the lungs. It is the most common cause of respiratory distress in infants and young children. In severe cases, bronchiolitis can lead to respiratory failure. The treatment for bronchiolitis is supportive and includes oxygen therapy, fluids, medications to help with breathing, such as bronchodilators and corticosteroids. A 5-year-old girl is brought to the clinic by her mother with a history of abdominal pain and diarrhea for 3 days. She also has a fever and blood in her stool. What is the most likely diagnosis? A. Gastroenteritis. B. Intussusception. C. Inflammatory bowel disease. D. Hemolytic uremic syndrome. Answer. B. Intussusception.